And we're live.
Good evening. My name is Martha Robertson. I'm Tompkins County legislator from the western part of the town. And I want to welcome everybody tonight and hope you have your mask handy for the next time you walk away from the screen. We have there are a lot of concerns in the community, and we want to try to answer as many of your questions as we possibly can tonight. We have our public health director, Frank Krupa, and he's also commissioner of mental health. We have Jason Molino, county administrator, and Amy Hendricks, the deputy county administrator, with us tonight. So we'll be able to try to tackle a lot of questions. As probably you all know, we have the highest number of COVID cases right now in our community since the beginning of the pandemic, unfortunately. And, you know, we've seen a rise, a sudden rise really, and a lot of that has to do with family gatherings, with small gatherings in people's homes. And that's where we're really focusing as we think about Thanksgiving coming up. And this really is a tough time of year. And we have to recognize that it's not just hard for all of us with our families and our friends, but it really does put a strain on the healthcare system, on our frontline workers, on the people who are doing the contact tracing. You know, we right now have capacity in our hospital and our medical system, but we've had to add more county staff members to do contact tracing and help our nurses at the health department. And we've seen a steady rise in hospitalizations at Cugum Medical Center as well. And we have to think about the broader community also. The governor reminded us over the weekend that we still need to really be paying attention to who's been disproportionately impacted throughout this pandemic. You know, older folks, frontline workers, communities of color, people who have a hard time social distancing because they might be in more crowded housing. And this is where we all can do our part and help out and try to protect everybody who is at risk in this community. Tonight, we're going to talk a little bit about some of the guidelines that the governor issued over the weekend about out-of-state travel, about gatherings, about bars and restaurants. And if you have questions, you should put them in the chat. And Dominic Recchio, our communications director, will be shepherding them to us as we go. But all these guidelines really come down to just a few simple things. Please remember to keep your physical distance from other people, to refrain from social gatherings, refrain from getting together, even in small groups, and wearing a mask, so important. These things really do work. We've seen this in the results from our contact tracing. We've seen it in our own community where we've had our own spikes and we've been able to tamp those down. So we can do it again. So with that, I'd like to go to the questions for Frank and Jason and Amy. Starting with Frank, we're going to put you on the spot quite a bit tonight. First, please make this really clear for everybody. What is the health department's guidance about holiday gatherings and travel, and how to stay safe?
Great, thanks, Martha. And our guidance, as it has been for quite a while now, is we're discouraging non-essential travel and gatherings. The official state rules are no gatherings over 10. And so obviously we're asking folks to follow that as well. When we talk about gatherings, what we're really concerned about is people getting together that aren't normally living together. So when you're within your household and it's your family, we know you're living together and that's kind of your own little bubble that you're in. What we don't want is to bring a family from the town over that might not have been in that bubble regularly and bring them into the home, and now you've got the chance for either party to expose the other. So it's just really important that folks think about those gathering sizes. And with the travel component, New York State has recently updated the travel guidance, So for the non-contiguous states, meaning the states that do not border New York, you are able to come into New York if you do a couple of things. First, everyone needs to submit a travel form on the New York State website. You can submit information about your travel plans and when you're returning. And so the 14-day quarantine that we've been talking about for quite some time is still in place. But there are now steps that you can take so that you don't have to quarantine. The first is if you're going to be leaving and you're going to be gone for more than 24 hours, when you get to your destination, or if you're in another state that's not New York and you're planning to travel to New York, 3 days prior to coming, you should seek a test. Then you can travel to New York. And once you arrive here, you need to quarantine for 4 days. And on that 4th day, you can get tested here. And if both of your tests are negative, then you are released from the quarantine and can go about moving about as you normally would.
To be clear, Frank, so you take your test, you come here, you quarantine for 4 days. Could you be real clear about what quarantining means? It doesn't mean just kind of stay in the new house, in the household where you're visiting, right?
Yeah, that's an important distinction, Martha. Yeah, quarantining means your own bedroom and preferably your own bathroom. But if you need to share a bathroom, it needs to be disinfected between each use. But it doesn't mean come to grandma's, aunts, uncles, other families, do a normal Thanksgiving meal and then return. That's not quarantining. So we want folks to be really clear that you need to quarantine if you come to New York from those other states.
Okay, and if people have more questions, they can, all that is spelled out on the county's health department website.
Sure, as well as New York State's.
All right, those are really important issues. What's our current contact tracing capacity, and how's our testing capacity locally?
Yeah, so testing capacity is going okay. There is more demand, certainly at the mall testing site. So folks might experience a delay in being able to register of maybe a day or two. And there are some times throughout the day where the wait could be as long as an hour while at the testing site. And I know that may feel like an inconvenience, but I do want to encourage folks that we are still extremely fortunate to have the level of testing that we have here, and that many other communities would be more than happy to wait an hour to get a test, because some of them have to drive multiple hours just to get to a testing site. As far as contact tracing capacity, we've been stretched over the last 5 or 6 days with the recent spike. We've called on our other county colleagues to come in, and we have staff from multiple departments that have been trained and are helping the nurses do the contact tracing. So we're meeting the demand, but we really could use a few days with some low numbers to help us catch our breath and get our feet back under us.
Right, and as you just mentioned before, the new cases today are just 6, which is great, but of course we're not testing on the weekends, so that's why it's always lower on Monday night. So it's not a sign that we've passed this. So you know, we've talked a little bit about holiday travel and family gatherings, and I know, Frank, you have your own personal, you know, some decisions that you and your family have made. Do you want to talk about that for a minute?
Yeah, I think I mentioned it on our last town hall as well. You know, I have my in-laws live in Michigan, and it's been a tradition as long as I've been married to my wife that we spend Thanksgiving with them in Michigan, and we're not doing that this year. We're going to stay home and celebrate Thanksgiving here because we don't want to risk the health of my mother-in-law, as well as our own in those travel things. And I understand these are not easy decisions, right? We're used to Thanksgiving as a generational holiday where we get together with multiple generations in our family and give thanks. And right now that setting is probably the highest risk setting for the transmission of COVID. First, you're bringing, multiple groups, small groups together. You're going to be sitting around eating, so you're not wearing a mask while you're eating, right? So there's, an added risk factor. And then maybe you have grandma and grandpa and some older members of the family there that are more susceptible to having significant consequences from contracting COVID. So we're really encouraging folks to think really long and hard about their Thanksgiving plans and try to be creative about seeing each other without having those gatherings in the home.
And we'll talk at the end of our session, we'll talk a little bit about some of the creative ways people can get together. For example, our family, I'm a Jewish, I have a Jewish family, and we celebrate Passover every year. This past April, we had a Zoom Seder, and in fact, it was pretty wonderful. We had people from California to Massachusetts, from Washington State to Virginia, Indiana, New York City, and even a family from Mexico. We'd never be able to get together in person that way. So there are many things to be thankful for. And I think planning on being together next year is one of them. So it's hard, we understand, but we can get through this. Could you get us up to date on the latest guidance about restaurants and bars? And I know there's been some new news there.
Yeah, so the governor, through executive order, has required that those places close at 10 p.m. Across the state. So that is a new requirement, and our environmental health folks have been reaching out to those businesses to make sure they're aware. I know some of our community partners have also worked with their memberships that work and operate and own those types of businesses to make sure they're aware. So we want to encourage folks to work with those businesses as they try to comply with that guidance.
All right, thank you, Frank. And again, anybody watching who has questions, you can type your questions into the chat in real time. Let's move for a minute to, one other question for Frank that's come in. Is there any way to know, is there any research on whether cases from people dining in restaurants, is the risk from people just in the restaurant, or is it because you're dining with people who aren't in your family pod, in your own bubble? Can you tell?
Yeah, we haven't had a lot of experience with it here, Martha, where we've had restaurant exposures that have led to clusters. But that doesn't mean it doesn't happen. And it has happened throughout New York State, which I believe is why some of the guidance changes. Restaurants are risky because you do have people coming together inside, multiple families there. You have to remove your mask to eat and drink. We understand that. That's part of what you have to do. But whenever you have that mask off, it just increases the potential opportunity for spreading it to others. And we've seen multiple demonstrations. The CDC has one on their website, I believe, that kind of shows how in a restaurant setting it can very quickly spread to multiple people. So, we want to support our local businesses, and we absolutely want to be as open as we can be. We just need folks to be careful.
Believe in carry out. We have a question that's come in. Have there been any cases traced to medical practices, doctor's offices, dentists especially, or healthcare facilities themselves?
So again, we've had cases in those settings. We have not seen clusters associated with those settings. Generally, either it's a healthcare provider that was exposed somewhere outside of work, or it was a patient that came into the facility. And thankfully, our healthcare workers are doing a great job of wearing appropriate PPE, using good practices in their offices on how to keep people separated and not create unnecessary exposures. So far we've done well, but we have had cases in those settings, but not a lot of transmission to date. Okay,
that's helpful to know. And one other before I go to Amy, how about masks? Can you give us advice about the best kinds of masks, and in particular, how people should wear them?
Yeah, we get that question a lot, and there is there's obviously different levels of good masks. Probably the most important thing for folks to understand is we're trying to prevent any coughing, breathing, sneezing from going further away from you and potentially exposing others. So when we're talking about a face covering, we want it to be fairly snug to the face, 2 layers of fabric that are going to kind of keep anything from getting through. I've heard the example that if you can blow a candle out with your mask on, your mask isn't appropriate enough. So it's really to think about that. We've had a lot of conversation about gaiters, those things folks wear around their necks and pull up. At minimum, you want to double it up because many of them are made of nylon and things can go through pretty easily. But you really have to judge for yourself based on the different types of materials that are out there. Obviously, the disposable surgical masks are a really good option because they are designed for this very purpose. They fit snug to the face. They're made of a material that will contain any cough, sneezes, or breathing. But they're also a bit more difficult to come by, and we want to make sure that they are available for healthcare settings when necessary. So, folks should make good decisions about mask wearing, and we have a lot of good information on our website about it.
Okay, I'll have to try the candle test later. Thank you, Frank. Amy, can you tell us, folks are watching all these colors all around the state. Can you tell us if we might be at risk of becoming one of the yellow, orange, or red zones, according to the governor's criteria? And what would it take for us to become that, to get into that zone?
Sure. So there's a lot of variables in each of those zones, and we're still getting more information on it. Those zones are around zip codes and different zip code areas. And I know I was out of the EOC for a couple hours today, and there's suddenly a new map that has appeared that shows all of those zip codes that has been created. And we are really looking at what that looks like. We have a lot of testing here, which is part of the entire methodology behind it. So while I can't give you a firm answer, I can tell you right now, we're trying to look at all of that so we can be able to really continue to monitor it. We are monitoring our cases and are looking at zip code to zip code and what does that look like? And we're starting to really dive in to understand it. At this point, I don't see us there yet, but we do see the increased cases. And so we are continuing to watch and monitor that.
Okay. All right. Thank you. And one more point about masks. Important to have it over your nose as well as your mouth, right, Frank?
Yeah, I saw that added on, Martha. Yeah, you got to cover your nose and mouth or it's really not serving a purpose. Again, trying to keep it from being spread and fairly snug to your face as well, preferably something that has a metal nose bridge that you can tighten around your nose. If it's kind of just laying against your face and you sneeze, everything's going up and out and around. So it is important to have your nose and mouth covered and have it be snug to your face.
All right, thank you. So let me go to Jason. How has the county been responding to the increase in cases? What are we doing about that?
Thank you, Martha. Well, what we're doing, Frank alluded to a little bit before, as we've seen an uptick in cases, we've been reassigning county staff to assist the contact tracing process. Our public health nurses are doing a wonderful job and the contact investigation process. And we've added quite a few staff members from other departments that have taken the training, Johns Hopkins training, to become a contact tracer and are now doing contact tracing in support of the health department. So that's one of the major efforts we've had internally, and we're going to continue to reassign staff as appropriate. The other thing we've done is we've added some additional staff to the Emergency Operations Center to support Frank and Amy and the team to ensure that they have the resources to manage the staff and work with our community partners, which is a big part of this response in general. So we've added quite a bit of staff. Every 2 weeks when we give our update, we have that one slide that talks about the staff power, so to speak, behind it. It's well over $1 million worth of staff time that's been committed to this response. Well over almost $1 million worth of actual expenditures, just over the past 10 months. So we continue to put the resources behind it, and the legislature has committed to the testing in the community-wide testing, and we're pretty much the first county to use county funds to do that. And that, I think, is a big part of our response and our ability to monitor the disease.
And very proud of being able to do that. And really proud of the community that has stepped up. So Jason, did you want to take over some of the next round of questions?
Sure, absolutely, I can. So I guess this is for all of you, and maybe we can go one at a time. But what fears or concerns do you have as the county has seen the highest active cases, hospitalizations, and new cases within the past week? Maybe Martha, you've been asking all the questions. Why don't you take the first crack at this as a legislator? What are your concerns as a legislator?
Well, it's really hard, and it's funny as the time changed and sort of the days get shorter. There's that general sense of sort of closing in, and depression can really be a problem in winter and in a great year. So I really want to remind people that we do have resources that any sort of help you might be needing, you could try 211. Just call 211. There will be people answering the phones over the weekend, the holiday weekend as well. It's 24/7 coverage there. So, and I think for families with kids at home, kids of school age, they have a special challenge of not knowing exactly what's happening this week or next week, whether you're going to be remote 2 days or remote 5 days. So I think that's really a huge source of uncertainty and challenges. Kids are struggling with this, and it's up to parents and grandparents to do everything that we can to help.
Yeah, very true, very true. I can attest to that, having 3 school-age children that are all now remote as of last week. Amy, what do you see as the biggest concern?
I think exhaustion. This is a pandemic and an emergency like no other, at least that we've experienced. Obviously, there's been other pandemics, but not in recent time. And I think people are tired. They're tired of having to wear masks, not seeing their families. I spent some hours over at the health department last week and seeing, our nurses are doing an exceptional job, and as are all the contact tracers. And as we see these cases rise, that means that they have to continue to put their lives on hold. And so that's a concern for me, is that, it is tiring to not be on the front lines, but those that are on the front lines and really doing this work, they deserve all the accolades that they've been given. But we're, 10 months in, and it's tiring. So I think that continuation, while important, is to remember to thank each other and to have that patience with one another, because as Martha said, it is turning into winter. Sooner or later, the white stuff will start coming, and, it gets a little more exhausting. So I know. So just, on the other side, while it's a concern that people are tired, I think we have to continue to have patience and support one another through all of it.
Good advice. Good advice. Frank, do you have any concerns?
No, not at all.
He's
Yeah, I think Martha and Amy kind of hit on the 2 things that are worrying me the most. My team at the health department and those that have been supporting them are exhausted. They've been doing this for almost 10 months now, nonstop, 7 days a week. And whether it's 1 case or 30 cases, it's still work that needs to be done that is on top of their other things that we would hope they'd be dealing with. And as we come into the holidays, that's going to get more difficult, right? These folks thought they'd have Thanksgiving off and Christmas and the weekends in between there to do the things that you normally do this time of year. And we have to schedule folks through that. And so we have to make sure that we're taking care of everyone. Martha mentioned, resources available. 211 is absolutely a great place for folks to look. But please know that our mental health and substance use providers in the community are ready and willing to help folks. Our crisis line is available 24/7, but more importantly than that, don't wait till something's a crisis. Even if you've never interacted with the mental health system before, reach out and have a phone call with the mental health department or with Family and Children's or any provider in the community and just see if maybe it's for you. There might be there's many different ways that we can provide support, and we try very hard to find something that works for everyone's particular needs. So now's not the time to be alone. If you've got something going on, you need some help, please reach out.
And that's a good point, Frank. And I want to circle back into what you just said about mental health services, because we've talked about that over the response to the pandemic, other needs in the community. And before I go to that, Frank, I have one question for you that's kind of an interesting question. The question is this the second wave of COVID-19, or is it still the first wave? And then the second part of that is what would it take to get to the third wave? And when would that come? Do you have any insight? Is this the second wave or is it not?
Yeah, Jason, I'm going to be honest and tell you, I don't know. It's really hard to know, because when you look around the country, is it just a continuation of a wave that's making its way around the country, or is it a true second wave? I don't know. And quite frankly, it doesn't really matter to me. It's more about what we're doing to stop any wave, whether it's the first, second, or third, from becoming something that overruns our healthcare system and exhausts our healthcare workers that are doing all of this. So I'm sure there's scientists out there that are smarter than me that could tell you for certain if it is or isn't. I just want us to stop all the waves.
Sure, I understand. Let's go back to the one to build off the statement you made earlier about mental health services and availability. Earlier, and the truth is there's, region by region, you have upticks in cases and downward turns in cases, as you can see in the summer when we were having, or in the spring when we had huge upticks in terms of New York City, other parts of the country didn't have it, and vice versa. So when we were seeing some of our lower numbers in the summer months, we were talking about other community issues that made the pandemic worse. And we were seeing now, and are we still continuing to see those issues in the community? Are they still relevant? And maybe both Frank, Amy, and Martha, you can maybe talk about one service or one area of service to the community that you foresee is continuing to be a concern that we're continuing to work on, and maybe just talk briefly about that. Maybe Amy, why don't you go first?
Sure. So I think the answer is yes. There were challenges pre-COVID, and there's still challenges that some are because of COVID or have been made worse because of it. Some of the things that we're looking at and continue to look at is, I think Martha has already mentioned, childcare is a challenge, and the whole industry is actually having a lot of challenges because they've had to reduce the number of young people that are allowed into their centers. And so with social distancing and all of that, and then you add in virtual schooling with different days, it's a huge challenge. I think also parents are experiencing that challenge. They are having a challenge of balancing everything, balancing the childcare, the virtual schooling, and then if they are both working, balancing work. I think there's some supports there though. Definitely working with other family members, working with cohorts. You don't have to be in person for all of that, so you can use Zoom. Zoom fatigue, I think, is another thing though that is real. I was on a call earlier where someone said it feels so different now to tell your child to use the computer when before it was limited screen time. And now you're saying you're going to be doing screen time if you like it or not. So I think those are some big things. I think Frank and Martha have talked about a lot of the services though that are available in our community. And I don't think we say it enough. 211 is definitely a resource of all resources. So, dialing that 211 number and asking for help, no matter what that help is really important. And then for those who can't call that number, perhaps they don't have phone, they don't have a service, are living kind of on the streets. There are other supports in our community. Soon, I know it's going to be getting colder. So things like DSS and our cold weather policies, along with Code Blue, having people go to the shelter. Those things are really, really important. I think the other piece to this is some people may be experiencing this for their first time. And so sure. 211 is an important resource, as well as, reaching out to a lot of our facilities. That's one thing that we do is provide those support services. So I'll leave the rest for Frank and Martha to pick up. I'm sure there's other challenges and support services they can coming up.
Martha, have you been, thank you, Amy. Martha, have you been hearing anything specific from your constituents?
Nothing specific. I think it sort of spreads throughout the community about things like on the childcare issue. That was his career, actually, teaching in a childcare center. So I know that the margins are pretty much non-existent. So when you have to separate, have even fewer children and extra cleaning supplies and et cetera, it's really hard. The Ithaca Area Economic Development, which we used to call TCAD, has a new program. The IDA has funded a grant program for daycare programs, daycare providers that have to make, put in shields or a special entry for parents, any special thing that needs to be done to comply with COVID. People should call TCAD. People have really gotten through this with just self-help, I think, in a beautiful way. I've seen this community be so creative, people reaching out, Loaves and Fishes doing sort of meals to go. So I would encourage anybody who feels maybe a little bit lost, try volunteering. It's something, volunteers are still really needed
Absolutely.
at Loaves and Fishes and many other places. In fact, you could probably go to 211 and find out where you could volunteer. And our local businesses, I think, are really working very hard. The Chamber is a terrific resource for business people trying to keep their payrolls going, keep their customers served, and everybody healthy. So there are a lot of resources here and a tremendous amount of resilience in our community.
Great. Thank you, Martha. Frank, I'm gonna ask you a specific question. It's gonna be more regulatory driven. Is there a regulation for markets or restaurants to perform daily checks with their employees or customers, including temperature checks on site?
So for employees, their reopening plans, or if they're an essential business, they're continuing to operate plans, should include daily screening of employees for the questions that I think everyone's being asked when they go to work these days about exposure to a known individual or having any symptoms. Taking actual temperatures is not required. Certainly it can supplement any screening questions that are being asked, but quite frankly, temperature checks are somewhat unreliable because different people have a fever at different temperatures, and really the more important thing is the question to the individual is, have you had a fever? Whatever that means to you. As far as customers coming in, certainly you could ask those screening questions if you're a smaller business. As a larger business is probably not practical. What's really more important is having consistent mask wearing, developing processes throughout your store so social distancing can be maintained, that 6 foot of separation, and really encouraging anyone that has symptoms, whether it's a customer or an employee, to not come to the business.
Thank you, Frank. Should kind of along those lines, should businesses and organizations be doing surveillance testing of their employees?
So more testing is always better. Well, that's what I think. More testing is always better. Because it's our best tool to find people that are positive, hopefully early in their positivity, so that we can get them isolated and others quarantined to limit the spread. It's not a requirement, but it is, if a business is interested. I know Cuyahoga Health Systems has a system in place to work out some details on how to make that happen for them. And we would certainly encourage any business that is interested to have those conversations and see what they can put together for their employees. The county has made it available for our employees through the legislature's supporting of testing for county residents. And so, I think as a county, they've shown that we support our employees in that way and think it's important.
Great. Amy, this is a good question for you. This kind of comes back to, I think, a question that's been asked continually through this. Are Cornell, Ithaca College, and Tompkins Cortland Community College working with the health department to plan for a safe return in the spring What do their plans include to keep from people bringing COVID-19 into the community when they return? Question that was asked at the onset of the fall semester and is again being asked at the onset of the spring semester. What do you have to say about that?
So we are in constant communication with all 3 higher ed institutions, and they all come together. So we meet with them, we kick off our Mondays and close out our Fridays with all of them to discuss what's going on, to kind of support them and talk through their plans. They often will share their plans with Frank or myself as they start to think about bringing students back. I think one of the big pieces is what Frank just talked about, that testing piece. So they are looking at how they are going to continue to monitor students and staff and faculty as they come to each institution. Now, they all have different strategies. They also have different, workforces, and they do different things. So they look different, but they are really consistent with trying to protect the community to the best of their ability. So they are working very closely with all of us. We do have regular communications, and they're working closely with each other. I should also say that as well. Cornell has stood up quite a sampling site and very much monitors the community, and they are working with their partners on that along with Kika Health Systems. And so I think it is a community effort, and all higher ed institutions are really working together on it.
Great. Thank you, Amy. Frank, I have questions here around public exposures. So it's a 2-part question. We've seen more public exposures from frontline workers and workers who live in other counties. Why are we seeing more people working while infectious? Maybe you can talk a little bit about infectious period.
Sure.
And so on and so forth.
Yeah, I think the important thing is to distinguish between language. Where when we talk about infectious, it doesn't mean that they were symptomatic, right? So somebody could work Thursday and Friday evening, they start to feel a little yucky and they decide to go get a test on Saturday or the following Monday. When we do our our case investigations and contact tracing, remember, we go back 48 hours before the onset of symptoms. So in that scenario, if that person had worked on Thursday and Friday and became symptomatic Friday night, we would be looking at what they did on Thursday and Friday as part of their infectious period. It doesn't mean they did anything wrong. It doesn't mean they even knew that they were sick. It's just the way the disease evolves and how we conduct our contact tracing.
And isn't one of
The
the
other
powerful things that many people are asymptomatic throughout?
Yeah, we haven't seen a lot of that here, Martha. What we end up happening is somebody will test positive, our nurses will give them a call, and then when we start going through what they did every day, all day for that period since before they got tested, they start to remember, yeah, maybe I did have a headache, or, maybe I was feeling a little fatigued. And because we're used to just pushing through those things, right? Sometimes you just don't feel 100%, but you go about your day. But when you test positive and then a nurse is questioning you about those symptoms and how you've been feeling, we start to remember. And so some people have less significant symptoms, right? And may get through with hardly knowing. Some folks are completely asymptomatic, but that has definitely been the minority, at least here in Tompkins County.
Great. Frank, can you clarify why our public notices don't always specify where in the business the positive case was, like we did with the Target customer service desk notice versus the Walmart notice, where it was for all shoppers to seek a test? It's a good question. We get that quite a bit, actually, why we don't specify in every notice.
Yeah, and a lot of effort goes into trying to provide as much information as will be useful. There's a couple of things. First and foremost, we're always trying to protect the privacy of an individual. Obviously, we want to alert the public if there's an exposure, but we still have an obligation to protect that individual's privacy. But in many instances, either the business is small enough that it would be hard to distinguish places. In a place like Walmart, the individual may have worked in multiple locations throughout, and so it would just complicate things by saying if you were in this, and this part of Walmart. So it really is about what we know about the case, where they worked, who they might have been exposed. Whenever we have information that we feel like can narrow it down for folks, we do try to share that. But in a lot of instances, it's a bit more challenging.
Okay. Thank you, Frank. Let's talk a little bit about the demographics of positive cases. Are there demographics of people testing positive without a known exposure that could tell us about their safety habits, such as do they frequent restaurants, wear masks, go to the office, etc.?
So let me break the question down. I think we do try to determine with the case if they know where there was a potential exposure, whether we already know about it because we placed them in quarantine, or they say, oh yeah, I was around so-and-so a couple of weeks ago and they told me they were positive. And so we can start to narrow that down. We're going to run the numbers for tomorrow. I think it's roughly 50% where we know or they know of a potential exposure source, and then another 50% that doesn't, which indicates community spread. So that's about where we are now. As far as where folks go, we generally are asking them about where they've been and what other exposures they might have created. It's very different. It's as varied as people are, right, and what they do every day as far as work and other activities like going to restaurants. I think one thing we can say pretty confidently is most people are wearing masks. I think part of the reasons you haven't seen us do as many public exposure notices as some other jurisdictions might have is because our folks are wearing masks, and we feel pretty comfortable if somebody is a shopper in a grocery store and they're wearing a mask and don't, they can't describe any long contact with any individual, that we're probably okay there. If they, of course, weren't wearing a mask, we would absolutely be doing a release, regardless of whether they could identify being around someone. So again, those guidance, those things that we're asking people to do, they really make a difference, and it really helps us not have to unnecessarily worry people about whether or not they were exposed while still keeping our numbers low.
Right. Thank you. That gives up a good point about exposures. We have seen as of recent exposures in households, but we've also seen instances about exposures or positive cases coming from those that were already in quarantine because they were a close contact. Yep. Can you explain for everyone, if there's anything good, why that's a good thing to know that the positive cases were already in quarantine? What does that mean about the process we're doing and what people are doing in response to that? Yeah,
that is the whole purpose of quarantine, right? The idea being is if someone is positive or sick and they could have potentially exposed other people, we put those other people into quarantine so that way if they do become a case, there shouldn't be any more contacts, right? So if you're quarantining effectively, staying in your bedroom, having your own bathroom or sharing and disinfecting, then there won't be additional exposures the earlier that we can catch that. So we don't ever want to see anyone become positive, and ideally they wouldn't. But if they do, that's the best case scenario for a positive case for us, because the exposures should be very limited, hopefully none additional exposures to that new case.
Great. Thank you. Thank you. And that's a good point to bring up. So Frank, here's a good question for you, and then Amy, I'm gonna go to you after this. So Frank, a lot of news about vaccines or vaccination in the news lately. I assume we have a plan, right? Mm-hmm. We do have a plan for distribution. Yep. Should people trust the vaccine? And when will the vaccine become available in Tompkins County? When are you going to bring us the vaccine?
Sure.
It's all on you, Frank.
It's all on you, Frank.
Yes. I don't feel that weight at all. So there are a good bit, several questions in there. Yes. First, we have what's called a medical countermeasures plan. It's a fancy way of saying vaccine or other medicine distribution plan in an emergency event. We've been working on these plans for almost 2 decades now. We practice them, we do exercises, we have staff that are trained, we have community partners that are trained. Ithaca College does a flu pod or point of dispensing every year now that grew out of a relationship that we had with them on being prepared to help distribute medical countermeasures. So we have a plan. Obviously, the details always matter. So who the priority populations are, how much we're going to get. is going to play a big role in how it gets distributed. We understand that likely in the beginning, there's going to be smaller amounts of vaccine available. So we're likely talking about hospital workers and high-risk folks like nursing homes and long-term care facilities will be priority populations. And then from there, as more vaccine becomes available, we will move into doing broader community distribution as those criteria expand, as the vaccine becomes more available. So yes, we've still got some details to put together. Cuyahoga Health Systems has agreed to be a partner, as they have throughout all of this, to help us. And as soon as we have vaccine here, we will get it distributed as quickly as possible to the priority populations as they're defined. You asked about, is the vaccine going to be safe? I trust our processes that we have. I do believe that between the federal government and the experts that we have at the state level that will be reviewing all of the information related to vaccines, that they will be safe. I'm a big believer in vaccines. As the public health director, I'm sure that doesn't surprise folks, but we have some pockets of unvaccinated people in normal times here in Tompkins County. And so we've got some work to do to make sure people feel comfortable and are able and willing to get the COVID vaccine when it's available.
How does
Just
the
as a
flu
side,
vaccine, can I just ask how the flu?
that was where I was going to go, but yeah, yeah,
Okay.
give the plug.
Yeah, so we have a vaccine right now that everybody should already have. And if they haven't, they should go to their local pharmacist or call their healthcare provider and make an appointment to get the flu vaccine. We keep talking about this COVID vaccine and how important it is, and we got to get it here quickly. And then we also hear about the flu, and the flu is just as bad as COVID. It's not, by the way, we won't go into detail with that, but we have a vaccine for the flu, so let's get that. Right? Let's do it because it's going to help us. One, the symptoms are similar. So let's not have to overburden our healthcare system that we just talked about, the nurses and others at the health department, the hospital. Let's not have a big flu season this year. And we also, we want people to be healthy because we don't know exactly how the comorbidities are going to work together or having both diseases at the same time. But I think common sense can tell us if our body's trying to fight two things, it's going to be harder than just fighting one. So please go out and get your flu shot.
Frank, I have one more question for you, then I have a few for Amy and Martha. The question here is, are we doing at least some surveillance testing in public schools in Tompkins County to see if there are asymptomatic cases?
So generally, it's being done by self-selection. So folks going to get tested at the mall testing site or through other testing mechanisms. There's not testing in any school at this point, at least not that I'm aware of. And we are testing a lot of children, either through close contacts or because the school guidance, in order to go, if you have any symptom that could be COVID related, you have to get tested before you can return to school. So we have a lot of children that are getting tested in order for them to have in-person schooling. So I feel pretty comfortable that we have an understanding within the youth population. And Ithaca City did at the beginning, before they went in person, they did a large scale testing opportunity and didn't find a single student that was positive. So I think between our community-wide testing that's going on and the screening and exclusion criteria for attending school, we're testing enough children. So we have a good idea of the prevalence within that population, and it's low.
So that would lead me to the next question. Since we're talking about testing, Amy, there's been discussion about a downtown testing site, meaning downtown Ithaca. Are there any updates that we can share about a downtown testing site in the city of Ithaca?
So we are working with Cuyahoga Health System on a downtown testing facility, acknowledging that it's going to be colder. We are looking for a site that could potentially be inside. I will say that it'll probably be a smaller site than what we can do at the mall sampling site. That's a very large testing facility and you can have a lot of cars go through. We're hopeful that we'll have that, in the coming couple of weeks. We'll bring something online is the goal. We're working very closely with Cuyahoga Health on that. On the testing too, there's one thing that I will point out is when the legislature kind of approved the use of funding for us to go ahead and expand to Tompkins County residents. That also has allowed those young people to get tested, as Frank mentioned. That's not happening in other communities. So for parents who have to have multiple tests to get their kids back in school, those costs come out of pocket because they often will be non-symptomatic, for the follow-up test. And so we have heard that concern from other communities, and we've been reached out to from some other community partners saying, how are you guys doing this? So I do want to, it was a big move from the legislature as well as our community to go ahead and invest in the testing and continue to look at that and making sure that we do have access. So a downtown testing site is definitely in the works, but we want to ensure that it's ready to go and can really move that forward.
And of course, people can get transportation to the mall site in the meantime.
Yes, they can. They can access that
Yeah.
through contacting 211, our favorite number tonight, apparently.
Yeah.
But 211 can help them with that transportation. And we do have a contract to get people there if they need to.
Thank you. Thank you. Frank, questions come in, and I'll read it off to you if you can take this. Are there any plans or the ability to utilize Cornell's testing capabilities while the students are away and there is presumably excess capacity available?
Yeah, it's a great question, Jason, and we've gotten it quite a bit. I think the important thing for folks to understand is that the Cornell testing isn't a thing unto itself. It is part of a larger system in partnership with Cayuga Health Systems. So there is already sharing of capacity that goes on where some of the samples collected at the mall are ran at Cornell's testing facility on campus. There are definitely conversations ongoing about the winter period. There's still going to be a significant amount of Cornell testing until the end of the semester. And then, we have the winter break while they're completely out of school. So capacity is I don't want people to think that it's just an all a Cornell thing. It is a partnership with Cayuga Health Systems, and it is already being used around the county to support testing efforts. And I would suggest that the running of samples, we have enough capacity for community demand right now. We have a drive-through facility that's seeing 500 to 700 people a day. We're talking about a downtown location. Generally, you can get a test next day or the day after, and you're getting your results the day after that. That is unheard of. I can't say that enough. That is not generally how a standard PCR test is being administered in other parts of the state or the country. So we're extremely fortunate here. So I'll end that with, yes, there are always conversations happening about testing capacity and what we can do. Collecting the sample tends to be the limiting factor, right? Who can do that, where we can do it, and all of those things. The lab capacity is something that is already, part of a system that is being used to meet Cornell's needs as well as to help support the community.
Great. Thank you, Frank. One question I missed earlier, and I'll take this real quick. Do we have any indication from New York State that there might be another version of a shutdown? I think the answer to that is, well, it's always possible. My suspicion, and Amy, tell me if you feel otherwise, that the governor or the state would probably take incremental steps to increase restrictions before they would do a full-blown shutdown again. Similar to what they did on Friday, where they restricted restaurants and bars and gyms from being open past 10 p.m. Does that sound fair? How
Yeah.
Probably approached.
Yeah, I think that's the approach. I think that, the zones that we talked briefly about, the red, orange, and yellow, is another approach. That was kind of step one. I'm not going to call them phases, but that was, the step one of looking at it. And I think then the 10 p.m. and the limiting of gatherings in personal residences is the next step.
Yeah. Will
there be more steps? There could be, but I don't think it'll be as broad and overreaching as last time. But I also say that with saying that, I'm asking the magic 8 ball this question. I'm not positive what the state will do, nor I think any of us.
Sure.
But I think
Thank
the
you.
message can be that, we have something to say about that. If people really do restrict their gatherings in homes, really wear masks, follow the guidance, then we know a lot more than we did last March. And
Yeah. Personal responsibility again.
Yeah.
So one last question, Martha, then I'll turn it back to you. This is a question for Frank. Frank, what is our current rate of infection? And at what point will you consider closing schools, or is that a statewide call or not a local decision?
Yeah, so our infection rate, if you're talking about positivity rate to testing, is very, very low. And that's because of the thousands of tests that are being done in our community every day. As Amy alluded to earlier, we're trying to crunch numbers now, looking at zip codes, trying to parse out testing for where people live. And so we'll have more information around that going forward. As far as schools, there's already some pretty strict guidelines from the state about when schools can operate in person and not related to the cluster zones. There's testing requirements if you're in a cluster and you want to remain in person. What I would tell you about our local school districts, and they've been amazing to work with. Each and every one of them has had a case at this point that we've worked through with them at least once. And they're doing everything that they can to try to keep students in person, but do it safely. And more often than not, what ends up being the contributing factor to going remote is staffing. It's having the adults there to be able to provide supervision effectively to the children. And when you start having a handful of folks quarantined, there was already a substitute shortage before all of this. So it makes it really challenging. We've been fortunate that we haven't seen transmission in our local schools, but many of them have gone remote for a certain amount of time. And oftentimes it's to figure out what to do around staffing and really peace of mind for their community. So each district's making those decisions for themselves.
Thanks, Frank. Appreciate that. Martha, I'm going to turn it back to you.
Thank you very much, Jason, and Amy and Frank and all the people sort of behind you and behind this screen that have really been keeping us safe and keeping us healthy. The contact tracers, the nurses, the people at Cuga Health Systems, you know, it's really been all hands on deck. And we think about Thanksgiving, we know what we can be thankful for in this community. So, you know, 10 days from now, it's not going to be the typical Thanksgiving. But my question to each of you is, what are you going to do in your pod to make that a special day? It doesn't just have to be a day to sit around thinking about what we're not doing. So help us with what are you thinking of doing on Thanksgiving? Start with Frank.
Well, I'm hoping our case numbers are low enough that I won't be at the health department. So that's the first hope. And then the second hope is I hope my wife has some ideas, because I haven't had a lot of time to think about what we're doing for Thanksgiving. I do know we're not traveling, and we will be staying home, you know, in our small family unit, and you know, doing things a little bit differently than we have in the past. But yeah, it is a time to be thankful for everything that we have and what we've been able to achieve as a community. And you know, thankfully my family hasn't been touched by COVID yet, so I'm thankful for that as well.
Amy?
Yes, like Frank, hopefully our case numbers stay lower so more of us get that Thanksgiving holiday. I think it's going to be a lot. I know it's going to be a lot different. There probably will be a Zoom family gathering at some point. And, you know, maybe there'll be, you know, sometimes we used to play Scrabble or things like that. And there are some kind of cool Zoom tools to do some of those things. So we might look at that with some of my cousins. But it's going to be a quiet, low key Thanksgiving. And personally, that's something that I need is a little bit more quiet and a little more low key. While it's been a lot of action lately, kind of staying in this zone, I think having a break and a relaxation day is probably my key for Thanksgiving.
Jason, I know you got nothing planned.
Yeah, nothing planned. We usually, so we have my wife's side of the family has a large family. There's 5 siblings and 13 grandchildren. So this is usually the one holiday that we all get together in one place, which is, you know, 25 strong. That won't be happening. So we will be staying here at home. And you know, like Frank had said earlier, a lot of schools have gone remote. So We have 3 school-age children out of 4, and my wife is balancing right now how to do the remote schooling, which is interesting because it's pretty much shut down our internet at the house when they're all on the device at the same time, which happened today because I was home for a little bit as well, which was interesting. Nonetheless, hopefully give her a break over the holiday. But we'll be having Thanksgiving here in T-Burg without the rest of the family. We usually play a big card game with all the cousins, but we won't be able to do that remotely. So we'll have to figure out some alternative to it. But I agree. Just thankful that we'll have the family close, and probably a little bit of downtime isn't going to hurt either, if we can get it.
Yeah, I totally agree with that. I mean, to anybody who can sleep in, please do. Yeah, treat yourself. I mean, it'll be a day to treat yourself and your nuclear group to anything special. Like, make that dish that takes 3 hours, and you don't usually have time to do that. Obviously go on the Netflix binge. I'm sure bundling up and going on a hike, but also, Zooming with our daughter in Boston, our son in Colorado. I haven't seen 2 of my 3 grandchildren since last Thanksgiving. But we're going to make sure we see them as soon as possible. So I think there's so much to be thankful for, and we all really encourage folks to stay in your household groups. Please try not to travel. Please take care and stay safe. And your family and your friends will be there when we're all ready to open up again. So good luck, everybody. Have the very best of holidays. Any last words from any of the rest of you?
Happy Thanksgiving.
Happy
Happy Thanksgiving. All right. Thank you all. Take care.